Okay, good morning and welcome everyone to today's webinar on the roadmap to recovery, Covid-19. I'm Henrietta Brealey, I'm the Chief Strategy Officer at the Greater Birmingham Chambers of Commerce, and I'm joined here this morning by Ruth Tennant, Director of Public Health for Solihull Metropolitan Borough Council, and Kevin Harris, Office Managing Partner for Chamber Patron RSM for Leicester. Between us, we're going to be giving you a quick update on all things Prime Minister's roadmap, the latest support available for businesses, Covid guidance for businesses, testing in the workplace, some strategies that businesses are putting in place to navigate through this time. So it's really intended to be that sort of quick sense check and update for chamber members on the latest news, views and details. As a quick bit of background, many of you will be very familiar with this. Today's a chamber member only session, but for those who might be a bit newer to us, the Greater Birmingham Chambers of Commerce is a not-for-profit business membership and business support organisation that exists to connect, support and grow local businesses. We've been in business for business since 1813, so as a fun fact for you, we've been around for longer than the Statue of Liberty. But today's chamber is all about helping local businesses with absolutely everything from starting a business and finding customers locally to growing and trading internationally. During the Covid-19 pandemic, we've adapted some of what we do to try and fit this digital time and keep connecting, supporting and growing our members through this somewhat unprecedented period, moving our opportunities to connect through member offers, networking and peer learning online, delivering support sessions like today, offering a bit of a sense check and update on the latest details, guidance, what it all means for businesses, also our lobbying and campaigning activities, of which I'll come to later, and certain services such as our free legal and HR helpline and our FinPoint Finance Hub, finding information on finance available to your business. And in terms of growing, we're continuing to help businesses grow their reach and profile locally through thought leadership content, Chamberlain daily articles and more. So what is going on? What's actually happening when it comes to the Prime Minister's roadmap? Well, as you're probably very well aware, we're firmly in step one. Anyone who's had kids at home, homeschooling, will know very well that schools and colleges are back. Some practical higher education courses are back. And later this month, we're also going to see some minor changes, less implications for businesses, but some minor changes around socialising, rule of 6, 2 households outdoors, still household only indoors, still guidance around minimising travel and no holidays, but some very sort of limited changes coming through in step one. When we look at step two, this will be coming through no earlier than the 12th of April, and I'll come back to that no earlier point later on because it really is important that that's not set in stone, just a no earlier than date. This is where we start seeing some bigger changes for businesses. You know, all non-essential retail will be able to reopen, personal care, so salons, beauty, barbers, etc., able to reopen. Most outdoor attractions, indoor leisure such as gyms, self-contained accommodation such as service departments, that sort of thing. Outdoor hospitality will be able to reopen, but all under strict Covid secure regulations and respecting sort of social contact rules. So for outdoor hospitality, rule of 6 or 2 households outdoors only. Some changes to travel, domestic overnight stays will be allowed, but only for single households. Still no international holidays, and there'll be some slight increases to the number of guests that can come to life events such as weddings, wakes and receptions, and event pilots start taking place, looking at what needs to be in place to allow for wider reopening of events, which will come up in step 3, no earlier than the 17th of May. I mentioned events during this step, hoping to see very significant life events, guests increased to 30, indoor events up to 1,000 or 50% capacity, outdoor seated, so your big stadiums, that sort of thing. 10,000 or 25% of capacity, and other outdoor events up to 4,000 or 50% of capacity. But we are still, of course, waiting for what's going to come out the pilots, what exactly that will look like, and the measures that events organisers will need to put in place in order to make that a reality and make that sort of, you know, all Covid secure and safe. Building on some of the pilot work that took place last summer, it's also going to be added to over the coming weeks. So in terms of other business activities, there'll be a return to indoor hospitality, bearing in mind the rule of 6 or 2 households indoors if that's been brought forward at that stage, indoor entertainment and attractions, remaining accommodation, hotel rooms, etc., and outdoor entertainment. Still domestic overnight stays will be allowed following that 2 households indoors, rule of 6, etc., and international travel, maybe. That bit will be subject to review. As you've probably spotted It's quite a challenging and contentious one and remains so. Step 4, no earlier than the 21st of June, is really where we see that much fuller reopening. Remaining businesses, including nightclubs, which have actually been fully closed since the first lockdown in March last year, so have been among some of the hardest hit by Covid guidance, they will be able to reopen, all being well. Domestic overnight stays and international travel. No legal limits on life events, can get back to big weddings, etc., and larger events able to take place. So that's the sort of skeleton plan when it comes to that roadmap to reopening. But there are a lot of caveats to bear in mind. You know, obviously at every single stage, COVID secure regulations, social distancing, etc., will apply until we're told otherwise. So if you can remember your COVID risk assessments, if you've not been in your premises for a while, and the other regulations that were put in place, you know, really important to be very aware of this, as businesses will have a key role to play in helping keep cases down as they start to reopen at each stage. And I know we'll be talking more about this shortly. Those dates are just indicative. They're not before dates, to give businesses a little bit of certainty, a little bit of understanding of, you know, what to expect when, or at least not to worry about having to reopen before certain dates. But they are subject to change. You know, the decisions to move each stage will be based on 4 tests: vaccine deployment continuing successfully, evidence that they're effective in reducing hospitalizations and deaths, infection rates are not risking a surge in hospitalizations, putting unsustainable pressure on the NHS, and that the government's not concerned that any new variants of concern are fundamentally changing the picture. You know, you've probably seen a lot in the press around Brazil variant, South Africa variant, UK variant. That's making sure that no new variant has come forward that might undermine the otherwise steps taken to control the spread of the virus or effectiveness of the vaccination. There will be a minimum of 5 weeks between each step in which they review all of this data, and 1 week's notice will be provided before moving to the next step. The good news is a lot of the data is moving the right way so far. There's a lot of positivity out there. There's a lot to be hopeful for, but it is just that reminder that this isn't set in stone yet. It's indicative rather than actually fully confirmed. Moving on to the support available, I'm going to give you a simplified rundown of the main schemes, because my goodness, it has got complicated. There are a huge amount of different schemes out there for businesses, different interventions aimed at supporting businesses. I think at one point at the beginning of the year, there were about 7 or 8 live grant schemes. What I've really tried to focus in on are the ones that are live and applicable now, to give you that sort of essential information. The first is the local restriction support grant for closed businesses, which has been for this lockdown period, and it started on the 5th of January and will run to the 31st of March, after which point current guidance says it will close. Per 42-day period, businesses can receive a grant of between £2,001 and £4,500, depending on their rateable value. It's for businesses required to close because of the national lockdown and responsible for paying business rates. And I'll come back to non-rate payers shortly. Next grant to be aware of is the closed business lockdown payment. This was that top-up grant, that one-off of between £4,000 and £9,000 for that same cohort of businesses, with applications needing to be made by the 31st of March. The new scheme announced at the budget is the Restart Grant, which is a one-off payment for businesses. Exact details to be confirmed, but the the full guidance has yet to be released. We're awaiting that and hope to have that very, very shortly. From what we know so far, non-essential retail businesses will be eligible for grants of up to £6,000 as they're opening earlier in the roadmap. It's slightly lower than for other sectors such as hospitality and leisure, where we believe grants will be available of between £8,000 and £18,000. Again, likely to depend on rateable value. But as I say, we're awaiting further guidance. The important thing to be aware of is that local authorities have been allocated additional restriction grant funding, which in a nutshell is discretionary for them to spend in their local areas. A lot of them have been using it to plug gaps, such as getting grants to those businesses that aren't business rates payers, to make sure they're able to access equivalent support for supply chain businesses or other areas of local need, but it really does vary local authority to local authority. So I really would encourage all of you to check your local authority's website and make sure you understand what's available in your area, and also the process for applying for grants. You know, for instance, some local authorities are asking businesses to apply for each different grant scheme. Birmingham in particular are asking businesses to complete just one application, and then they'll just match them to grant schemes as they become available, and in fact encourage businesses not to complete multiple applications as slow them down. So that's your area. A couple of other very quick updates. You're probably aware that the coronavirus job retention scheme has been extended until at least the end of September, and the current proposals are for it to continue on current terms until the 30th of June, bring forward 10% employer contribution in July, and then 20% for August and September. Another piece to bear in mind is that for claims from the 1st of May, actually there's a greater range of employees that you can furlough. It'll be for employees who are employed from the 2nd of March. Provided they meet other criteria, etc. So more employees will be able to access that who are more recently employed. Self-employed income support scheme, there's 2 further instalments to come on that. The final instalment, that 5th instalment, will include a turnover test to make sure that businesses have been impacted. Self-employed individuals' earnings have been impacted by COVID-19. Full details are to be confirmed. Business rates holiday, 100% relief extended to June for those businesses who have received it previously, 66% relief for the rest of 2021-22 for most of those businesses in those key sectors. VAT relief, again, that was a measure that we heard from a lot of our members was something they were keen to see extended for hospitality, accommodation, visitor attractions on certain supplies. That's been extended at the 5% rate 30th of September, and then it will be raised to 12.5% from the 30th to the 31st of March. There's going to be a new recovery loan scheme to replace civils and bibbles, which will be another 80% government guaranteed finance thing, which you'll be able to apply for from the end of April, ending 31st December. We're still waiting for the full details on that though. And then, of course, lots of other bits and pieces announced in the budget and before, including the super deduction, trading loss carryback rule, help to grow scheme, apprenticeship incentives, and Kickstart. And if you're interested in finding out any more about those, feel free to pop a question in the chat and I'll be happy to share the information that I have. Of course, we know that the support available isn't quite enough to help all businesses that have been impacted by COVID-19, and we're continuing to lobby hard throughout this time through our various stakeholder publications, engagement with MPs, ministers, regional authorities and beyond. So if you're looking at this going, actually my business is going to fall through the gaps on these, or it doesn't address the major issues that we're seeing, do get in touch. We're collecting all of that at kbm@birmingham-chamber.com, which stands for Keep Business Moving. But we've also, of course, got Kevin here today, who'll be talking about some of the strategies outside of government support that businesses are adopting to navigate through this time. That's more than enough from me today. Hopefully that gives you a quick update on where we're at. I know there's been rather a lot of developments, breaking news, new announcements over the last few weeks. So that's intended to be a sort of stop, sense check, where are we up to? But I'm now going to hand over to Ruth to talk you through the public health perspective around businesses, COVID secure, COVID testing.
Thanks, Henrietta, and thanks for inviting me along here today. So, as Henrietta said, I'm Ruth Tennant. I'm the Director of Public Health based at Solihull Council. And for those of you, as most of the general public weren't familiar before COVID with what public health in local government does, what we're really here to do and what we've been doing throughout the pandemic is really help to put in place things like testing programs. We're running contact tracing services. We're doing a lot of work right across different sectors around what they can do to manage cases and outbreaks. So, you know, really had to put in place, as I guess a lot of you have, really a lot of measures to try and control the spread of COVID within the virus. So within the borough. So as you'd expect, a pretty hectic year with all of that. So I thought what would be helpful is just to give a bit of context about where we're going with COVID. And some of the things that you might want to be thinking about as you're moving into this next phase of thinking about restarting business. So based on some of the experiences that we've had throughout the pandemic so far. So if we click onto the next slide. So just a quick snapshot of the current position. So as Henrietta said, we have seen a really steep decline. So obviously what happened was, particularly just before Christmas, we saw the emergence of a new variant. It spread very quickly, and we went into a very big second wave, much more significant actually than the first one. So and we're now coming back down that big mountain that we've gone through. So as of today, our rates for both Birmingham and Solihull are below 100 per 100,000. And just to kind of put that into context, what that means is about 1,000 new cases each week in Birmingham, just over 100 in Solihull. So still quite a reasonable number of new cases and people who are being infected. So I think it's worth bearing in mind. And we are trying to communicate this to the public. We still have got quite a lot of this virus out there, so we're not done yet, but clearly in a much better position than we were a few weeks back. A couple of things just to bear in mind about where we're seeing COVID and who it's affecting at the moment. So what's been very clear for quite some time now is that actually the highest rates are in working aged adults. So it's very much, particularly concentrated actually among kind of 19 to sort of 49 for age groups. And the reason for this is those are people who are most likely to be out and about. They'll be taking kids to school, they'll be going into work, they'll be going out and shopping. So, that's the group that really are spreading the virus. And I think the key thing to note about that is that group is not yet vaccinated. So although vaccination is rolling out really quickly, really positive, and that is clearly providing a lot of good protection for that older age group who were hit quite very badly first time round, and that gives us a firewall. We still have this group of people, and a lot of them will be people in your workforces who are not yet vaccinated and are therefore at risk of the virus. And for those of you who are watching the news yesterday, Chief Medical Officer saying we've got to be really watchful now of the third wave, particularly in that age group. And I think the key thing to bear in mind is when we were at that peak back in January, the average age of people in intensive care was actually early 50s. So it does show you how much COVID can really affect that kind of working age group. And the other thing that we're learning more and more about is actually the impacts of long COVID. So people who might not have been particularly ill, but actually have got those long-term health impacts, which again, impacts on sickness, absence and things like that. So these are the things we've got to really bear in mind as we're going through. And I think, as Henrietta said, that's the reason those dates aren't set in stone, because we really need to watch how this plays out over the next few weeks or so. So new variants, Henrietta touched on that. At the moment, we've got the kind of top dog new variant is actually the UK one, so homegrown in Kent, and that was the one that really caused the problems back at the beginning of the year. What we do know is this virus is very adaptable, it changes, there's very detailed surveillance in place to try and spot new variants, but where those pop through, we need to be able to react really quickly. So for those of you who kind of working in or around the Sandwell area, you'll be aware that there was there was a blitz on testing as a result of cases of the South African variant. Now, the big thing with those is that what we don't want that to do is to disrupt progress, to start affecting how well the vaccine works, because obviously that would set us back again. So again, the more we can do now to get rates really low, the more we can minimise the chance of any of those sort of new variants popping back through. I think the other thing to bear in mind, and this will be an issue for all of us on this call, is everybody wants to get back to normal now. So I think after the roadmap was announced, what we saw is people out and about and back on the streets, and there is now this real appetite for everything to go back to normal. And for all of us is a real challenge to kind of manage things, so to say, yes, we are getting there, yes, we will move back, but actually we still have some way to go, and we need the public to stick with the measures, only progress onto those changes in the national roadmap when we can and when it's safe to do so. And again, challenge for all of us to really get that message through. And very obvious point, and you'll all be really familiar with this, is that the COVID secure measures are absolutely key as we progress. So all the stuff we've been doing so far around hands, face and space, around risk assessments, really important that we keep that as strong as possible, and don't assume that because the numbers are coming down, we don't need those. We probably need them more than ever actually at the moment to really manage things safely. And I guess the other thing, just for people to be aware of, there is now really strong surveillance. So all the time we will be looking at where there are cases, where there are little clusters of cases. So I like to talk about my kind of cockpit dashboard of data, where we're looking the whole time to say, okay, we've got a little cluster of cases. It might be in a particular particular community, or it might be in a particular workplace. So we have things like the app, the NHS app, which will be showing, actually we've had 2 cases of people, in this workplace. Or as things open up again, if we do get kind of clusters in hospitality, we'll have all that information. So I think really working with you, that if we do see that, we're able to go in and act really quickly, so that we stop the spread. Next slide, please. So I think in terms of what you can do, and these are really simple messages. So clearly the government position at the moment is still for people to work from home wherever possible until rates are lower. And interestingly, what we have seen is actually after January, you could see people creeping back into the workplace. And I know where I work, we did see this creep back in. And actually what we have seen, quite interestingly, is outbreaks happening where that happens. So workplaces where people had been working from home, people came in, and then we suddenly got a spread of cases within the workplace. So again, I think it's just something to bear in mind for people where you are running business where that is still possible, even if it's not desirable. That is really important until we get rates as low as possible. And the basics really work. And I think one issue we've got at the moment is, there's fatigue with those hands, face, space, ventilation messages, but they absolutely do work. And I've talked here about that kind of nudge principle, that we've got to just keep reinforcing the messaging, thinking about how you put that out in a way that people don't kind of start ignoring it, because that all does work, but we've got to really keep the pressure on with that. And one thing that's really important is that kind of role modeling. So can you be using your staff to really role model this 100% of the time? And obviously, if you're in environments where you've got customers coming in, the more your staff are the frontline champion for doing the right thing, again, that will, we're seeing that places that do that really heavily and invest in that, it does seem to really help with some of those customer behaviours. But again, be really interesting to hear your experiences on some of that. Just in terms of some of the learning that's coming through, what we've seen really clearly right across this is where we do get workplace related outbreaks, quite often you can have workplaces that are doing 100% the right thing. So they've got really good risk assessments, they've done all the right things. You go in and you have a look, and that's all absolutely spot on. And it's, as ever, it's the human factor. So it's what people are doing outside of work. So quite often we'll find actually those people were car sharing, or they popped out and they went for lunch together, or in schools we've had a lot of staff in staff rooms. So it's that thing where people kind of go off duty a little bit, they drop their guard, they kind of forget those measures, and those are the points we really see spread. So that's something to really think about in that workplace. What does that look like? And really encouraging people to think beyond what they're doing in the kind of 9 till 5 into what's happening around that as well. So again, lots of information out there about that, but just really think through as you're reopening what that might mean for you and what your risk points are. The other really obvious thing, and I'm sure many of you will have thought about this, is really starting to think about, are your staff confident, understand what the process is around vaccination? So vaccination's rolling out incredibly quickly now. So the local NHS are now, they've moved into that kind of 50+ age group. So we are starting to see working aged adults coming through. What we do know is we've got what's called vaccine hesitancy in some people. So we know that there have been concerns from women about fertility. Absolutely no evidence at all that that's a problem. But again, once the word gets out on social media, that can spread. So there's some really good sources of advice for where you can go around the messaging with that. But again, the earlier we get people through and vaccinated, the more that will really provide that really strong firewall. We also know, we think young people may be less likely to get it because they think, well, they won't be affected. So again, vaccine is really important for everyone. It's not just the kind of older cohort. So drip feeding that message through, so when people do get a text inviting them in, or they get the letter, they're primed and they're ready to go. You'll have probably heard a lot about testing as well. So huge amount of testing rolled out at the moment. So There are now these very rapid tests. They take about half an hour to get a result. Lots of different routes you can get those now. So both Birmingham and Solihull councils are running test sites. So I know in Solihull, our leisure centres are now basically taking over doing testing. So those are places that are open for anybody. You can send your staff into that. We recommend doing it twice a week. If you go to those what we call assisted testing centres, it'll all be done for you. So the test, it'll be recorded online, result will go straight back to your employee, and it'll all be done for them. So good quality service. There's an online booking system, so hopefully pretty straightforward to use, and we've had good feedback on that. So that is an option for you if you want to use that. The government is also opening up testing schemes where you can sign up to do your own on-site testing. So again, there's a slide that's got the links to that if you do want to do that. We are talking quite a lot to businesses about how they do that. It does require you to train up staff and have areas you can do that. So there's quite a lot of information there about how you can do that if you're a big enough business and you think that's worth investing in. We will also be setting up what are called community collection points, so where you'll be able to pick up test kits to do at home. There's going to be a lot of work to kind of educate the public about how to do that safely, and I know anyone on this call with kids will probably be working with them to get them to self-test at home over the next few weeks. So testing, it's not 100% perfect, but it's just an additional way of finding those positives so that we can find them early and again get them out of the workplace and get them self-isolating. Obviously really, really important, anyone's got symptoms, straight out of the workplace, get them tested with those kind of PCR tests that again you can book online, and sticking with that really strict self-isolation for 10 days. And again, we do hear people saying, you know what, I'm feeling okay, I'm fine, I haven't got any symptoms, so I'll go back to work. That's a risk for you and them. So again, really making sure that people absolutely stick with that. The other thing I would just say is if you do start seeing cases in your workplace, act early. So your local public health teams, if you do start seeing that, will be able to come in and advise, look at what you're doing. So we put contact details in the next slide about where you can go for that. So what we do know with outbreaks of people who go in and start, shout early, get help early, it really minimises the risk of that spreading. So next slide. I know I've probably taken up a fair chunk of my time. So really these are just some sort of key resources. So where can you go for vaccination information? Want to find out anything more about that testing scheme, this is where to go, and also contact details for your local public health team. So hopefully that's some useful information if you want to dig into any of that in a bit more detail. So I think that's it for me. Thanks, Henrietta. But again, very happy if anybody's got questions, and I think that's the roadmap that you've covered anyway.
Fantastic, thank you, Ruth. We've already had a few questions start coming through for Ruth on testing in particular, but before we go into Q&A, Kevin, over to you. So we've been through the sort of the formal business, the roadmap, the legal requirements, the best practice for businesses on COVID secure. What's your take on how businesses outside of this are adapting and responding to the current environment?
Thank you, Henrietta, and good morning, everybody. Apologies for the headphones, and if I lose you on reception, it's because I am actually this morning having my super fast broadband fitted after 2 years of campaigning for it. So I'm working on the 4G at the moment, so let's hope that holds out. Okay, I've just been asked to do a few minutes here in terms of what I've noticed as impact on business of the pandemic and some of the lessons that I've seen businesses adopting that may be useful to share. But before I do that, I just want to give you a bit of background as to why I'm probably in a good position to do that. And it's probably made up of a combination of the various roles that I fulfill. So my main job is as a managing partner in a firm called RSM, a large professional advisory firm. And we work with thousands of SMEs across the country. We also have 4,500 employees in the UK. So I can talk from an employment point of view of having 4,500 people working at home almost overnight, which is a challenge on any business, as I'm sure many of you have had. I also sit here as a chair of a local enterprise partnership, a LEP. So I'm chair of the Leicester and Leicestershire LEP, East Midlands, not West Midlands, although I am a West Midlander, I'm a Birmingham lad. I chair the LEP, the board in Leicester and Leicestershire. So I've been right at the front end of dealing with businesses, SMEs through the Growth Hub. As you're aware, LEPs have growth hubs, which are often the key point of contact for SMEs to find out about support. And on average, we have had a 5-fold increase in the pandemic of inquiries into the Growth Hub with the same level of resource, which has been a stretch, obviously around support for businesses. Henrietta mentioned the significant changes in the levels of support the government have given. And often Growth Hubs for LEPs are the point of contact for a lot of businesses to find out what they are eligible to get. I also sit here as a member of the board director of the Midlands Engine. And I just come off a call before this one with Sir John Peace, actually chair of the Midlands Engine, in terms of how business support will be structured post the pandemic. And the Midlands Engine has what's called an observatory, and the observatory is there to collect data and understand the trends and the impact that's going on in our local business communities. So enormous amount of research into that, and the observatory is a great pool of information to know what is actually going on in the wider business environment. As part of the engine, I also sit on the investment fund, and that's really relevant because I'll come on to in a minute in terms of access to finance for business. So I sit on the board of the investment fund, and then my final role is as a board director of East Midlands Chamber of Commerce, the fellow chamber alongside Greater Birmingham, and I've been on that board for 15 years and very close to the SMEs. So that's a bit of a quick a preamble as to why I'm probably in a pretty good position to gauge what businesses' reactions have been, because there's thousands and thousands of businesses that each of those positions touch in my day role and my other roles to understand what's going on out there in the business world. There's lots of evidence come forward, there's lots of experience come forward, but to be honest, it's very much changing by the day. And what I would say first and foremost is that the pandemic has impacted every business. Obvious to say that, and you may say, well, that's clear, but it has. It's impacted every business, and I would say also that it's impacted businesses to much varying degrees. Some businesses, because of the nature of what they do and how they operate, have managed to deal with the challenges that the pandemic has thrown at them in a relatively modest way without major impact. Many businesses, however, have found that it has completely changed the way they operate and the way they need to operate going forward. And I will come on to my sort of summary of that in a few moments. I think the other thing to bear in mind is that whilst there are some terrible implications of the pandemic and the effect it's had on people at a personal level and their lives, there are also some businesses that have actually changed for the positive as a result of the pandemic. And I want to touch on that because I have calls now, as many calls with businesses that are in distress and need support, as I do with people saying that actually, because of the pandemic, we have changed our business and we have done things that we wouldn't otherwise have done. And I think it's very important to touch on that as part of that discussion. So how have I tried to sort of bring it all together? Well, all of that information, I've really come up with what I consider to be, and I've started to call the 5 Ps. And I'll go through each of those Ps in a few moments, but I've tried to bring everything together under one of those key headings, and not only the experiences that businesses have had, but I'm also trying to give you some pointers as to maybe if you're a business owner, what you may want to be considering now as we enter this next stage of the pandemic. The first of the Ps is about people. And it's widely said, isn't it, that a business is all about your people. Your people are your biggest asset. As a partner in a professional services firm, I've been saying that for 25, 30 years. It is absolutely correct and fundamentally correct, because without people, the business can't really do anything. So the challenges I've seen faced with people, not least so much in my own business, of trying to run a business with 4,500 people working at home. Who would have thought that? And it's absolutely changed, I think, a lot of how we as a business deal with our clients in particular. I come from a background as an auditor where I spent most of my life out at business premises, other businesses, working face to face with clients and customers. That hasn't been possible. So we've actually got to the situation where you're doing roles that you would never have thought could be done virtually are being done virtually. What that leads for into the future, I have no idea. What the future of my own profession, professional services and auditing will be, who knows? But it is actually completely changed around the way we interact with our customers. My biggest concern, and one of the concerns that's been raised to me, is that with people being out of the work environment, they obviously are missing out on that social interaction. And that social interaction, whilst it is also incredibly important for well-being, as we all know, and mental well-being, it's also very, very important for training and development. And I have a real concern, certainly in certain aspects of our business communities, that we need to ensure that the younger generation, who are going to be mostly impacted more than anybody by this pandemic, actually still have the support around them to grow and develop and learn. And I'm very keen to look at that in my own business. We will obviously go back to a change about home working and office working, but it's very, very important that the mental well-being and personal well-being of people stays at the forefront. And I think now most employers that I speak to are actually already making arrangements for, we won't return to normal. How it was before is not the way it can be going forward. So we will make changes. And I'm very interested to see what those changes will be. So people, to me, has probably been the biggest aspect, the people management. I look after a team of about nearly 200 people, and trying to keep in touch with them on a regular basis is a challenge. I would normally have done that by being in an office environment around 50, 60, 70 people every day. Don't have that anymore. So how do you actually deal with that, and how do I ensure that I keep that degree of relationship going forward? So people is number one. The second P for me is process. The biggest change I've seen outside of the people management side in my own business and other businesses is the methods by which companies now operate. So many changes have taken place in the way businesses transact that it would not have happened without this pandemic. So IT and usage of IT has been enormous. I've seen such changes that would not have happened without the pandemic. And one of those is, and comes back to what I said earlier about home working. Would employers have been able to trust fully their workforce to work in that way? And would they have had the technology and the platforms to be able to do it? Now they are there. And what it means is we have a different relationship, I think, between employer and employee going forward. So processes, one of the key areas I think we've seen is about data security, risk management. People are concerned about the fact that they are, flowing data through in a way that they wouldn't have done previously. Can that data be accessed? Is it secure? So I'm actually seeing now a lot of people turning to alternatives in terms of how they actually secure their data, data usage, and IT and process management is really important. So I think process is number two. Number three is property. And this is one that's exercising my mind heavily at the moment. My firm has 36 offices around the UK. We have quite a large footprint in each of those offices. On average, we may have had over 100 people in each of those offices. I have absolutely no idea how many people are going to be returning to those offices on a daily basis. And yet I have a big property portfolio, as do my fellow partners, to look after. Most businesses have the same. What is the work environment going to be like? What do we need our biggest asset, often our property, to be? Are we going to have to invest heavily to create the kind of work environments that is going to attract people back? And actually, if you are an employer that really wants your workforce to get back and they've been used to working at home, how are you going to deal with that? Because that's not going to be an easy challenge. So property and the future of property and physical assets, very important. My fourth P is purpose. And what I mean by this is my business, and I get very involved in doing a lot of buying and selling, mergers and acquisitions, succession planning for businesses. I have seen a significant shift in people's views about their future of their business. Taking a long, hard look at, do I really want to carry on? after this, especially if the financial position of my business is going to be very different. We've been involved in a lot of sales of businesses which wouldn't have been planned coming into the pandemic. And therefore, I think people have used the opportunity to step back, look at what their business was set up for, take stock of the work-life balance that they have. And actually, is this now the time for me to reshape my business, take on a different strategy, move the business into new territory? And that thinking time is really good, because in a lot of business owners, one of the biggest challenges they have is finding time to think about their business rather than just working on it. And I know there's a lot to work on with the business at the moment, but you need to put that time aside. My final one, as an accountant, you'd expect me to say, is something around finance, but I couldn't find a P for finance, so I've called it pounds. So my fifth P is pounds. Well, the financial impact, enormous. We've seen it. Government support packages, Henrietta mentioned, they have changed. They are changing by the week, by the month. Providing advice and support to businesses around that is a complete minefield, I find. And I know a lot of the advisors in the organizations I work with are finding the same challenges. Trying to identify what your business is entitled to, how it can access, is incredibly difficult. We're trying to find smoother ways of doing that through things like the growth hubs. But you have to bear with it because it does change by the day. And also, obviously, each sector has been impacted differently. In my role in the Midlands Engine Investment Fund, I've seen the need for additional forms and new forms of finance for business going forward. One of the discussions I'm having with governments at government levels is what kind of funding packages and support we need for business in the new world. The historic and traditional ways of funding businesses simply may not work because balance sheets for many companies are going to be significantly impacted. So their ability to lend further will be impacted by that. So what support a business is going to need, will that mean different models and different structures to what we've had for the last 30 years in business? And I think the other thing I would really say on that one is that from a finance point of view, it's going to be very difficult for us to establish where that finance is going to come from. And I think there'll be a lot of change in the climate that we have out there for access to finance. It's an area I'm very heavily involved in. And I really do feel for a lot of businesses who are going to emerge from the pandemic in such a way that the normal challenges and the normal models that they would have had will not cope with it. And there's going to need to be a lot of support. We are emerging from this. Hopefully we see light at the end of the tunnel, but the way I see it now is that this is going to be probably the most challenging stage for business. We have seen a lot of government support. It's given us a little bit of a false economy in that regard. We are emerging into a more realistic economy, and I think we need to be very mindful of the fact, as happens with similar cycles in the past, that this becomes the most challenging time for business. And the support needed around business is going to be even more. That's the case I'm pressing to government, and certainly to Bays and the business secretary, is that businesses will need even more support, different types of support, especially in terms of keeping their employees on board and the training and development of people. So there's a number of things in there, and I know there's a lot to take in. I would just summarize things by saying, as I said at the start, every business has been impacted differently. Some businesses have used this opportunity to really come out as a stronger business. And if you have any time left or any hours left in your day and are running a business at the moment, that won't be many, I would urge you to take stock of the fact of what you want your business to be going forward. And now is the time really to start thinking that through, because it is a very different world that we will emerge into. So hopefully, Henrietta, that's been of some use. I'm happy to take any questions as we go through.
That's fantastic. Thank you, Kevin. And certainly that piece around calling for government support as we move forwards, we're very much aligned on that as well. You know, there's a great big bright light at the end of the tunnel. Lots of businesses talking about the pent-up demand they can feel and see, you know, even hospitality businesses that have gone out with tentative reopening dates, being overwhelmed with bookings. There's a lot of pent-up demand and opportunity, but you need to keep laying down the track to get to that light at the end of the tunnel, make sure that businesses are able to navigate through what is going to be a challenging time, and as you say, a challenging environment. in terms of access to finance and beyond as we come through into the brave new world, fingers crossed, post-COVID. We've now got just under 15 minutes for questions. So you should all be able to see the Q&A function at the bottom of your screens. We've had a few questions come through already. The first couple are for Ruth, and the first is on vaccinations. So there's been quite a bit in the news around vaccinations and allergies and who can and can't have a vaccine. Do you have any advice or know when more advice will be given for people with severe allergies? Jackie's put a question in that as an EpiPen carrier, the talk of vaccine passports and contradictory information out there on whether it's advisable to have a vaccine or not is a worrying situation, and whether EpiPen carriers, those with severe allergies, will be left behind. Do you have any thoughts or reflections on that?
Yeah, thanks for that. Really good question. So as part of the vaccine rollout is being led by the local NHS. Within that, there is a very specific, what we call an allergy pathway for anyone who is an EpiPen carrier. So when it's your turn for vaccination, you will be given information about what that means for you. But in practice, the current situation is actually for the majority of people, they can be vaccinated safely. It will very much depend where you have your vaccination done, and what level of supervision you need to have in place to do that will very much depend on the severity of your allergy. But what I would say is there are very specifically trained staff who are in place within our vaccination programme to give you that advice. So there is a huge amount of work being done. In the early days, there were quite a few early adverse reactions. It seems to be kind of much more controlled now, but as I said, there's a really, really kind of clear clinical pathway. So you won't get left behind when your turn comes, if that helps.
Fantastic, thank you. And a good bit of reassurance there. So we've got a few questions around testing, and then I'd also have a question for Kevin around businesses pivoting. But when it comes to lateral flow testing in the workplace, is there training for staff available? Is there sort of more wraparound support for businesses apply through the portal to get on the sort of list for receiving tests, etc.? But then what happens? Is there support for staff to get them up to speed? What does that all look like?
Yeah, so what I'd suggest, if you are interested, there's a link that's in the presentation which takes you to the Department of Health and Social Care expression of interest. So if you do want to do it, you need to sign up by the 31st of March. And what there's a sort of very clear process that they will then take you through. So what that involves is really practical things like how much space do you need? How does that need to be set up? How do you register kits online? Where do you order your kits from? Training for staff doing that. It is, there's quite a lot involved in that process. So if you're thinking about it, it is worth looking through that. We've got a slide pack that we've had from the department, so I'll send that through Henrietta to go around, that just gives a bit more information on that. You do need to register by the 31st of March. And what we do know at the moment is that test kits at this stage will be free. So the expectation is the kits will be free until the end of June, but my understanding is there isn't any additional resource for things like staff to do the testing. So it clearly is a commitment for businesses to sign up to that. So for some people that may be a more cost-effective option than sending your staff to one of the public testing centres. But for other places, you may decide you want to use that route, because obviously it takes some of the kind of hassle out of that. There was a second question, wasn't there, about testing? The training. So there is online training as part of that Department of Health package. What we are also offering, if it's helpful, so we have brought people down to some of our testing sites, because what we know, sometimes it's really helpful just to see it in practice. So if there are businesses that want to set it up and want to kind of come and see it for themselves, again, our contact emails are in the presentation slides. So there's one for Birmingham if you're based in Birmingham, one for Solihull if you're in Solihull. So if you do want to kind of come and see it in practice, again, we can just facilitate that through the sites we've got set up as well.
And certainly that community testing for those who are unable to or not yet ready to set up workplace testing is really effective. We've got a very small number of key workers at the Chamber who deliver export documentation and are acting as export officers for a number of big exporters around the region, so have had to physically be in during this time. Because believe it or not, they still have to physically stamp documents. So they every week, a couple of times a week, we're getting them down to community testing sites for their free tests, and it has been very, very easy. It's different local authority to local authority again, but do look online. It's been very straightforward, booking appointments, getting the confirmations, the results come through incredibly quickly at the moment. So for people looking at that right now who aren't totally sure about in-house workplace testing, really good option there. Kevin,
yeah, thanks. And the other thing I would just say on that, they're 7-day-a-week services though. So again, you know, I know staff may not want to go on a Saturday or Sunday, but they are open all the way through the week, and we are looking at standing opening hours and things. So actually, if we do think there's more demand at different times of day, we will look at flexing that. So do let us know if you've got any feedback on that.
Fantastic. There is another question on testing, but before I come back to that, Kevin, you talked about how businesses are adapting the 5 Ps. Is there anything that really stands out to you, you know, without naming any names, any businesses who really stand out as, you know, they've pivoted just right, they've managed this really effectively? You know, we've seen it from some chamber members who have been hospitality and retail businesses who have managed to pivot to doing very successful high volume online events with a sort of physical delivery activity. Are there any that stand out to you as, you know, that was a really clever way of pivoting during this time?
Yeah, well, I think probably that sector that you mentioned there, I think the hospitality sector is the one that's probably seen, you know, I deal with a lot of clients, a lot of businesses in the hospitality sector. And I've been amazed at some of the fantastic ideas they've come out with. I mean, it's pretty customary now, isn't it? We see it now quite normal for those kind of establishments to be offering things that they wouldn't have done before. But actually, a number of businesses stand out for me. I mean, I think, you know, I had a business that shifted quite early in terms of what it manufactured and what it did into manufacturing PPE. They did it so quickly. I couldn't believe that they were able to adapt their machinery and their processes literally in the space of 5 weeks to get from manufacturing what they were making before, which was a completely different sector, into manufacturing PPE. And that has now developed into a service line, which isn't going to be PPE, but it's linked to PPE. But again, when I said about impacts that you would never have predicted, that would never have happened. If they hadn't have switched into PPE originally, they would not have then thought, and then now into food hygiene and food technology side, which wouldn't have happened without that. So I think you have to look at it on the basis of, you know, things have happened that have had dire consequences and impacts. And, you know, I wouldn't want to understate that for 1 minute. But actually also, you know, those businesses and those more entrepreneurial businesses and businesses with people who have seen opportunities have really taken their businesses into another line, and it will set up their businesses for the next decade or decades to come on the back of those decisions. So I think just open thinking and looking at how your business can adapt is really, really important. But yeah, there's a number there. East Midlands and West Midlands I could name. I won't name them because they might be quite embarrassed about being named. But I've certainly seen, you know, those businesses that have come through incredibly well.
Fantastic. And we know, obviously, you know, it's easier for some businesses than others to pivot depending on what they do, but certainly we've seen some where we've gone, God, that was a really good idea. Good on you for jumping on that so quickly. Got a question from Gemma around sort of vaccinations in the workplace and also regularity of testing. So are HR going to be able to ask staff to confirm that they've had a vaccine? You know, is there any guidance currently available on that, what can and can't be asked, and, you know, whether it all will need to be voluntary? We'll start there and then we'll come back to the testing question.
So really good question on confirming vaccination status. So I know what a lot of workplaces are already starting to do. So things like social care providers and the NHS where staff have been vaccinated, they are asking people to let them know. So, for example, we have been vaccinating some of our frontline care workers, and again, we have asked them to let us know. Now, you can't compel someone at the moment, and again, I think this is moving, and I suspect there will be kind of clearer legal positions on some of it, but at the moment, I think the way we've been approaching it is very much, it's really helpful for us to know, because it helps us to understand our risk mitigations and what we need to have in place. So doing it as a voluntary basis, but really saying it helps us to kind of run our business if we know. So that's the first point. But again, if we do see anything coming through around kind of legal advice on that, we can share that with the chamber to get out.
Thanks, Ruth. So still an emerging scene, still looking like voluntary at the moment, but we'll keep you posted, as no doubt many businesses will be grappling with the same questions at present. We're going to be wrapping up very shortly. So as an early warning, Kevin and Ruth, I'm going to come to you very shortly with your final message to businesses on your particular topics. Before we do though, Ruth, how often would you recommend testing when back in the workplace? Is it twice weekly? Is there clear guidance on that?
Yeah, so the optimal is to do it, what we say, every 3 to 5 days, because basically that gives you the best chance of finding the positives. So that's what we're recommending to people. It's about that sort of frequency. So that's roughly twice a week, but that 3 to 5 days is that's the best chance of finding cases.
Fantastic. Right, then without further ado, Kevin, your final message to businesses, what would that be?
Okay, my final message there would be, and I like to say, practice what you preach. So these are the things that I'm doing in our business at the moment, and I know my fellow owners of the business are. Lots of engagement with the team as we run into this next stage and hopefully what will be a return to work. What does that need to look like? What are you expecting? I think there could be an expectations gap here between what kind of work environments people would like to see and what's actually going to be there. And that's going to take time to sort out. So lots of people engagement, ensuring that people feel comfortable in returning back to work, because people will need that confidence to do that. The other thing I would say is that if you have specific needs within the business, make sure, if you haven't already, that you tap in to all of the resources and support that's available. The chamber is a fantastic area for that, of course, but also things like the growth hubs within the local LEPs. If you haven't, been on there to see what's available, make sure that you tap into that, and really go out there and make people aware of what your business is going to need to help it survive. I get involved in various boards and panels of trying to find out what it is that businesses need and will need going forward. There's something called the economic recovery cell, which a lot of organizations in each area are working on. That is to put in place the steps that we need for short, medium and long-term recovery. Engage with people, engage with the support structures around you. And I would say good luck, because it's going to be a very difficult time for people coming out. There is light at the end of the tunnel, but it just presents more challenges.
Fantastic. Thanks, Kevin. Engage your teams, align expectations, tap into the support available, and raise awareness of what you need. And on that note, as mentioned earlier, if there is anything that you're struggling with at the moment, you're falling through the gaps in available support, do get in touch on KBM at birmingham-chamber.com. KBM standing for Keep Business Moving, and we'll be sure to pick up and escalate any concerns that you have. Ruth, your final message to the business community.
Yeah, so I think think third wave. So the next 2 months are going to be really critical. So tighten up everything you're doing, encouraging your staff to think we will get through this, but we've got to take it really, really steady and really carefully. Polish off your risk assessments, freshen up your signage, do it really, really well, because hopefully this will be the last time we've got to kind of manage this at this scale. And again, think about those practical things you can do around vaccination and testing as well. And final thing is, if you get any problems, get help early. If you get cases, clusters, get help early.
Brilliant. Thank you both very much. Think third wave, get help early. So a lot of messages there around that, sort of tapping into what's available. Everyone is going through exactly the same thing at the moment. Every business is grappling with the same questions that you are. We're going to keep doing this over the coming months, bringing people together, talking, sharing concerns, ideas, thoughts, and generally just helping each other out as we all navigate through this time. So thank you so much, Ruth and Kevin, for giving up your time to speak with us and our chamber members today. Virtual round of applause for Ruth and Kevin. And hope to see you all at future chamber webinars. Thank you all very much for joining.